Good morning. Thanks so much for tuning in. Based off of data ending last Friday, the 25th, 1,751 cases were reported, which is an increase of 502 cases from the previous week. Reports include increased cases identified in congregate settings such as schools, nursing homes, and assisted living facilities, and correctional facilities, as well as an increase in community transmission. At least 4 additional schools were added over the last week with additional cases, which will be further detailed at the end of today. Now, 6 counties in Montana represent 65% of all the new reported cases. That's Yellowstone, Roosevelt, Missoula, Flathead, Cascade, and Gallatin. Significant increases in cases were noted in community transmission in Glacier and Roosevelt counties, as well as with a cluster associated with Montana State University. Many Montanans are still acting like this virus is in our presence. They're Montanans who are taking their personal responsibility of protecting others seriously, in turn helping to prevent the spread to those most vulnerable to illness or death from this disease. Yet in some ways, there's also Montanans who are acting as if this virus no longer exists. And if the past couple of weeks isn't evidence enough, one only needs to look back to where we were when we first gradually reopened the state in late spring. The curve was flat, and the virus hardly made an appearance in our communities. Now more than ever, we need all Montanans and businesses to act as this virus is still in our midst, because it is, more so than we've ever seen since before COVID-19 entered into our state. The state has currently filled personnel resource requests in tribal areas that are seeing concerning spread of the virus. There's currently 72 individuals supporting efforts on the Northern Cheyenne, Crow, Fort Peck, and Blackfeet nations. These areas include requests from the tribes, some Indian Health Service facilities, health centers, long-term care, and emergency medical services. Personnel include a mix of Montana National Guard members and civilians. The duties being performed include nurses, CNAs, contact tracers, EMTs, ambulance drivers, incident management, and others to drive individuals and goods to those who may need it. Well, I so appreciate everyone who's stepping up and giving of their time to make sure that we're supporting these high-need areas. The fact is the virus is leading to resource constraints, placing a burden on local public health, and causing disruptions to the livelihoods of those living in these areas. We're also in the process of filling additional personnel resource requests. And in anticipation that we'll need additional volunteers with medical expertise to help fill in when resources become limited or healthcare workers become sick. Also putting out a call for registered nurses, licensed practical nurses, paramedics, emergency medical technicians, and more. And this is through the healthcare mutual aid system. And our hope is to have a sufficient list of names on demand of medical experts through paid volunteer positions to help our communities in need. We've significantly increased our testing capacity from where it was in the early days, thanks to the hard work of many in our state who've worked diligently for months to establish Montana-based solutions. Montana State University is now performing on average at least 1,000 tests a day, 5 days a week. We continue to utilize the Mako lab with up to 2,000 tests a day, 7 days a week. Our state lab is ramped up its capacity significantly, adding more testing equipment that now allows the lab to process about 1,300 tests each day. This increase in testing equipment has allowed us to maximize the number of tests with current staff, but also decreased the amount of time it takes to process these tests. And all along the way, including to this day, the state lab staff has worked early mornings, nights, and weekends to get the job done. They continue to work staggered shifts and shuffle schedules to meet the ongoing demand. And we continue to maintain a sufficient amount of testing as we do continue to maintain a sufficient amount of testing supplies on stock, keeping up with the demand, even as we've conducted over 80,000 tests over the past 4 weeks. Symptomatic individuals, close contacts of known positives, and congregate care settings are our priority for testing. Though we're not back to having mass community testing events throughout the state like we did in early summer, we are conducting asymptomatic testing through targeted areas in some communities as well as congregate care settings. Throughout the summer, the disaster and emergency services have worked to secure personal protective equipment to prepare for the fall and for schools reopening. Today, we're able to retain a 90-day supply of PPE in our state stockpile, such as N95 masks, 3-ply disposable masks, gowns, gloves, and face shields. Additionally, hospitals, community health centers, and local disaster emergency services agencies have all been offered a cache of PPE supplies as they enter into the fall and winter months, and shipments are already underway and will continue over the following month. In these ways, we are prepared. However, our concerning trend in cases right now should cause us all some alarm. And what's most concerning is knowing what can happen to our healthcare system if we don't get the spread of this virus under control now. We've seen it happen in other states, and there's no real reason for it to happen in Montana. It's not that we're overstressed right now, but our hospitals are certainly busy, and this puts us in an especially difficult position as we move into cold and flu season. We need to get this virus under control. And the way we can do it is by once again taking this virus seriously. We have mask requirements, social distancing requirements, and other public health guidelines. They're in place for a reason. If these public health vetted and public health recommended guidelines are followed, we can protect others and prevent the strain on our hospitals and reduce the community spread and transmission that we're seeing occur. And as we do our part, certainly at the state level, I hope people will also ask for and expect the same locally. They should be asking this and expecting the same locally of their city and county officials and their local leaders. Here with me today virtually are several of the medical experts who've been working day and night over the past 7 months through this pandemic. They see firsthand the capacity of our hospitals, and they also know what can happen if we don't further take this seriously. First, I'll turn it over to Dr. Mark Williams of Bozeman Health, to be followed by Drs. Greg Tierney and Bridget Brennan, and then Dr. Shelly Harkins of St. Peter's Health System. Dr. Williams.
Governor Bullock, thank you for allowing.
Line muted.
Hold on one sec, Dr. Williams. Go ahead, Dr. Williams. Can he hear me now? Do you have mine? Dr. Williams.
Yes, sir. Okay to go ahead, I presume. Shall I go ahead?
Dr. Williams, go ahead now. I think we've got the AV fixed.
Dr. Williams, you can go ahead. Dr. Williams?
No, we're good. Good? I think so. We should.
Just let me know when to go ahead. Okay. Thank you very much. Obviously, navigating our virtual world is one of the challenges COVID has presented to us. So, Governor, thank you for allowing us some time to share what's going on with our healthcare. As you know, we're now entering the 8th month of this COVID, and we've learned a lot about this virus during this time. It's been a very stressful time for everyone, especially those on the front lines and caring for COVID patients, our healthcare workers, our first responders, and many more. And despite the low numbers that we have been experiencing, we're now back up to full operations while also maintaining preparation for a COVID surge. As you all know, we were one of the first areas in Montana to experience that early spike in cases. And over the most of the summer, we saw our numbers go down as we embraced those smart public health measures that you've already shared with us, Governor. Wearing a mask, washing our hands, social distancing. We were able to open back up our businesses and now our schools. And here in the Bozeman and Gallatin area, we also benefit from being a very youthful and generally healthy community. With all that being said, our numbers are going up quickly. Our hospitalizations are up slightly, and there are increasing concerns from our hospital partners throughout the state as to what they are similarly experiencing. There is no doubt this is the time to double up and protect our families, our businesses, schools, and healthcare workers. It's not just the stress of caring for COVID-affected patients that affects our healthcare workers. It's the same concerns that families in Montana are sharing. What if my child's teacher gets sick? Who will care for my children so that I can work? What about my older parents who may be around my children? These same stresses impact most families in Montana. But perhaps what is really stressful and very demoralizing for our healthcare workers observing others who fail to embrace these simple healthcare precautions and put people at risk. We have dedicated nurses who work in our assisted living facilities and nursing homes who literally cry at the end of a shift because they feel a degree of helplessness in taking care of those residents of those facilities who are effectively cut off from families and friends because some of those in the community can't abide by these simple measures. It's interesting that the same medical science that goes into our remarkable vaccine development efforts is the same science that supports wearing a mask, social distancing, and practicing good hand hygiene, and also getting a flu shot. We don't do these things because of our political persuasions, but because we want to protect our families and our community. This is no different than our choosing to drive on the right side of the road or wearing a seatbelt. We don't do it because of a political party. We do it because we're protecting ourselves, our families, and our community. So, Governor, I just want to offer thanks to the efforts of the state and county health departments and all those individuals who have put a lot into this. I want to thank a special thanks to all those who embrace and role model these public health behaviors. And to those who don't yet, please reconsider. We know you really do care about your family and friends and community, and this is a great time to make a difference. So again, to all of you, thanks for allowing us to share a little bit from Bozeman Health and Southwest Montana community.
Thanks, Dr. Williams.
Hello. Thank you, Governor, for inviting us to join you today and for having this press conference. My name is Dr. Shelly Harkins, and I have the privilege to serve as the Chief Medical Officer and President of the Regional Medical Center here at St. Peter's Health in Helena, our state's capital. Overall, our local community has done a great job over the last 7 months to flatten our curve and limit the spread of COVID, but we do sense we are losing ground here in Lewis and Clark County and our surrounding areas. We believe the previous success is due to the fact that many people in our community were following the basic, simple, everyday precautions to slow the spread of the virus. And we greatly appreciate everyone who is continuing to adhere to the public health guidance, masking up, not gathering in groups, keeping their distance from others not in their household, and getting tested for COVID when they're not feeling well. As I speak to you today, we have 4 people at St. Peter's Health who are hospitalized due to complications from COVID-19. We wish them all a quick recovery, but this is more than our typical caseload over the last 7 months since COVID arrived in our community. Recently, in the last days to a couple of weeks, the Helena community and surrounding counties that we serve are seeing a very concerning increasing trend of COVID-19 cases. Just yesterday, we recorded a record number of cases here in Lewis and Clark County. So we are losing ground in the battle against the spread of this virus. And while our hospitalizations may seem low compared to other hospitals in Montana, we anticipate that based on the increased number of cases, we will see an increasing number of hospitalizations in the coming weeks to months. At this pace, we may reach our maximum capacity here at St. Peter's Health. It's important to remember that typically it's a few weeks following an increase in reported cases that we would see hospitalizations. The impact of COVID on our health system has much less to do with hospitalizations here at St. Peter's Health from COVID at this point, and more to do with how widespread disease, like we are now beginning to see here, causes staffing constraints that limit our ability to care for patients. When our staff are out on mandated quarantines after being deemed contacts or because they are ill from COVID, our capacity is strained. We've got a lot of equipment, technology, medication, and know-how, but we are nothing without our people, our trained, dedicated medical professionals who can utilize all of that equipment and technology and medication to save lives. When resources are strained at the local health system, all the patients, even those with non-COVID medical conditions like heart disease, lung disease, diabetes, kidney disease, many others, they become at risk of being left without adequate services to stay well. It is the morbidity and mortality from all of the non-COVID related diseases that we are concerned about too. COVID affects all patients, even those that don't have the disease. So like we talked about often in the early days of this pandemic, we have to re-flatten the curve. By doing so, we will save lives and help protect the frontline workers that we all depend on to keep us safe and cared for. It's football season. I've got a kiddo with small fry football here in Helena, and I often use football analogies. And so I'm going to again. It is as if we're going into halftime and we've lost the lead. Halftime adjustments are critical. We have to change our course, especially since in the next 2 quarters, we will likely also have additional opponents on the field. It will be flu and cold season. So we can change our course if everyone in the community doubles down on the basic, simple, everyday actions that slow the spread of COVID-19. We endorse the simple precautions shared with you today because we know they work. There is no question these precautions work to slow the spread of COVID and prevent it. In closing, I just want to share with you a statement that we've repeated many times here at St. Peter's Health, and that is that the outcome of COVID-19 on our community will have little to do with the virus and everything to do with our behavior. Thank you very much.
These two could, yeah. Thanks, Dr. Harkins. Thanks, Dr. Williams. I'll now open up for questions. If you'd like to ask a question, press 5*, and it'll show that your hand is raised. If your question's already been answered, you can press 5* again, and knock on wood with technology, you could also ask questions for either Dr. Williams or Dr. Harkins. First question, phone question.
Excuse me. Hi, Governor Bullock. This is Marie Sergio with NBC Montana, and I have 2 questions. Can you hear me okay, or is the echo bad?
I think we can hear you okay.
Certain communities right now? Line unmuted. Am I back? Can you hear me now?
I can hear you, Marisa. Go ahead.
Okay. I'm sorry. I have 2 questions. My first is there a specific concern over hospital bed and ICU bed capacities in specific counties or cities right now?
Jim? Turn that one over to Jim Murphy, the head of the Infectious Disease Bureau.
As far as hospital capacity and ICU capacity out there are some specific concerns in parts of the state. The eastern part of the state, the Billings area, serves a large region of Montana, as well as parts of Wyoming. And we have seen some instances there where supplies are getting pretty tight. And as we move into respiratory season in the fall, as you heard Dr. Williams and Harkins express, there's concern that those systems are going to be even further stressed. There have been days where they've been down to single digits in capacity with only like 8% of beds remaining, for instance. So this is something we're watching closely, and we may be increasing our reporting on this too with additional details in the coming weeks as we move into influenza season.
All right, thank you. And my second question is I was able to speak to Dr. Birx this morning in an interview, and she recommended that we shouldn't gather as families or neighbors right now in Montana because of the increase in cases, and said if we have been together and had our masks off, urging folks to go get tested. I'm wondering if that's a message your team is getting behind.
Well, I think I didn't have that conversation with her. Look, we even know with community transmission that most people actually get it from people you know. So that even in any sort of groupings of folks, no, it makes sense certainly to wear masks along the way. And I think that that's one where certainly in those communities of community transmission, we really do have to take additional steps on the ground, and would encourage the community leaders to be underscoring that. Next phone question.
Hi, Governor. This is Iris Samuels with the Associated Press. My question is, how are you balancing the pressures of managing the pandemic during this highly charged political environment, and have these pressures shaped your decisions on implementing new COVID-related restrictions?
Iris, look, from the beginning, we said, right, that we'll manage this from a public health perspective and an economic perspective, not let the politics get into this. It's unfortunate that outside, like we are in a highly politicized time, but this virus doesn't care about politics, right? This virus doesn't care if you're a Democrat or a Republican. All it wants to do is figure out a way to increase transmission. And we know that we have the steps, if folks will adhere, that will limit the transmission. But that's one of the reasons why in this, like underscoring that we can't do that from the state alone. I mean, in communities of significant spread, I think county commissioners and mayors should be having a press conference every week as well, saying what they're doing to help our health officers in our schools, to make sure that we can get our hands around this. I so appreciated Dr. Harkins' analogy, right? That, look, a whole lot of folks out there would like to say that this game's already over and we've taken care of it. Clearly, as we see increases, this is halftime. And more than just the restrictions that happen from Helena, because we have what's in place in communities to limit this transmission. I mean, an expectation is that a bar or a restaurant in Helena and a bar and a restaurant in Billings will be following the same state guidelines and the same requirements along the way. What we have done to date is based on the science. It's based on what the health experts provide. So we just have to ensure that the adherence occurs. And that adherence doesn't just come from Helena. The expectation is that every single one of our communities are following the public health directives and the suggestions along the way. Did you have something? Doc Holzman would like to add something as well.
I just wanted to, I'm actually taking a step back, but I wanted to add something that we were having technical difficulties, so we weren't able to get Benefice Hospital on, and we will look to do that in the future. But talking to their medical officers, they just wanted to kind of reiterate what some of the other docs had said and actually what's happening in their community. And they wanted to say they have 37 people currently in the hospital. with COVID, 7 in the ICU, and that they're at 115% of capacity. So it's real important to understand where we are right now, and as people have stated, coming into the colder weather, when we see flu and RSV and normal increases in hospitalizations, this is very concerning, and we have, to start even changing things around right now, it's going to take an incubation period. So again, just reiterating what everybody else said, but I wanted to pass on those notes because they had sent me a text on that.
Thanks, Dr. Holzman. Next question.
Hello, Eric Dietrich with the Montana Free Press here. I think Harrison kind of asked about this a little bit, but Governor, have you considered reinstating some of the stricter health directives we had earlier in the pandemic? Is there some sort of threshold there that you have in mind if cases continue to rise that would take us back?
Yeah, so, there's not specific metrics for moving back, I suppose, to phase one. We'll continue to talk to the public health experts and public health recommendations, evaluate the data of new cases and our positivity rate. But more than the restrictions, it really is like we know what needs to be done to get our hands around this virus. And we've seen it happen in communities in our state where numbers have gone down. And from that perspective, that's what I think we need to be focused on, is taking these steps that these doctors speak about, local public health has spoken about, and we've heard nationally. Wear a mask, social distance, don't gather in large groups. Those are what keeps further transmission from occurring. And I guess I'd also note, Eric, that we have seen, look, right now the Blackfeet Nation, for an example, has put a 14-day, I think, stay-at-home order in, and that what we typically have done at the state level is set thresholds along the way and set expectations of both behavior and directives no matter where you are in the state. But certainly local public health, at times, looking at their level of community transmission. And when I say local public health, this isn't just put on the local public health officer's back. It's their recommendations to county commissions and the health boards that may well, and in some instances probably should, take even more restrictive actions than what we do at a statewide level. Next phone question.
Good morning, Governor Bullock. Thanks so much for holding this press call. This is Nikki Willett from Yellowstone Public Radio. I'd like to ask a question, and then I just want to make sure that I heard Mr. Holzman's numbers correctly. So if you wouldn't mind holding my line open after my question, I'd appreciate it. Thank you. This spring, the Montana National Guard built at least one temporary medical facility in buildings as a possible overflow site for low-risk, non-COVID patients. Are there plans to bring that kind of overflow facility back online in communities like Billings that are having trouble keeping up with their hospital demand?
Yeah, so Nikki, early on, we did some work to say, let's, plan and prepare, not panic. So we set up more or less an overflow facility that's in a permanent position in the Flathead. And then we had one that we set up in Billings Metro, got it all ready, and then have it torn down in Connex boxes. So that could be deployed in Billings or in other areas around the state if that's where we needed to set it up. We have that readily available. I sure as heck hope that we don't need it, but we could set it up in Yellowstone County, or we could set it up in other places in the state. But again, the actions that we'll take in part will dictate whether something like that does need to be set up in the future.
how does that work? Would the hospitals in an area request that that site be made available to them, or would the state make that determination?
No, and my medical team and the EPIs and Jim Murphy, I mean, they're all at NDES is in regular discussion with the hospitals as far as what they might need along the way. So it wouldn't be the state just saying, all right, we're going to go set this up. It'd be in consultation with the local community.
Thank you. And then for Dr. Holzman, I just wanted to make sure, Benefice has 37 people in the hospital with COVID, with 7 in the ICU, and that makes them at 115% of capacity?
Yeah, this is Dr. Holzman. That's correct of the information they sent me. I would highly encourage, especially in the local areas, these providers are available to speak with you, and if you want to get in contact with them after the press conference for more detail and more information for your individual communities, please do reach out. If you need contact information, we can help you get that. But we appreciate them coming forward and speaking here, but they're leaders in their communities and they're willing to speak.
Thanks so much.
Yeah, it was technical difficulties that kept the Benefice docs on. But as Dr. Holzman said, if anybody wants to hear more specifics in Great Falls, certainly it sounds like they're willing to have a conversation. Next phone question.
Yes, Governor Bullock. This is Casey Elliott at the Dillon Tribune. I got a couple of quick questions. Have you rethought requiring fines, considering the rather large continued spike in cases? And by my count, it seems that most of the counties in Montana have at least 4 cases. Have you rethought maybe making a blanket mask requirement?
Requiring what was your first question, Casey?
Fines. Fines as apparently the federal government recommended.
So 15 counties right now, I think, at least that was yesterday, had less than 4 cases. Look, even if you're in a county that hasn't hit that 4-case threshold, you should be wearing a mask. You should be wearing it in restaurants, in retail, because you don't want to get to that point. I mean, remember when Phillips County had 0 and jumped up big, but then they also took it seriously and got it back down. And the second question, as far as fines if you're not wearing a mask. Look, first, I think that a fine would, at the end of the day, it would be local jurisdictions being, either the sheriff or police that'd be levying that fine. But less than about fines, I don't care if you're in Dillon or in Billings or in Helena, I mean, the local leaders need to also equally be saying that this isn't about fining people. This is about making sure that folks are doing the right thing. I mean, when you have even in Gallatin County, they're actually giving out some incentives and awards, randomly going down the street, encouraging people to do this, because this really is about all of us taking personal responsibility to help the collective. And the collective is making sure that we don't end up having our hospitals overwhelmed, making sure that our schools don't end up having to go back to completely online. Next phone question.
Governor, it's Phil from the Great Falls Tribune.
Hi, Phil.
Hi, sir. I was listening, and I've already talked to your staff about it on it. You mentioned talking to Dr. Burks, and was just saying how he had recommended some of the areas of the state be closed down. But yet you said, you didn't do that, I guess, but I didn't know what your feelings were hearing it from her. Are you considering any of her advice on this, or
Yeah, and look, I was probably less than artful in as much as, no, I had a conversation with Dr. Birx. Our health team did. It was last Thursday or Friday. And that happened as a result of, as we know, the vice president was visiting Montana, and we're on a call with him at least typically once a week. So I said, while you were in Montana, you might want to have a little COVID-19 response or meet with our crew. So they set up Dr. Birx. She had looked at the numbers, and it wasn't like, let's shut down the state, but it was like she expressed real concern principally at the time about Yellowstone County and Flathead County and some of the areas in our tribal communities. And it's concerns that I share. And had said that, yeah, in those areas, there should be consideration of further enforcement of masks. And there should be a discussion potentially about whether or not like taverns and things remain open. And those are things that any local jurisdiction can certainly enforce. It becomes a little bit more difficult, certainly at the state level, to say, community X and community Y, you're going to be doing this. It's one of the reasons why we gave that opportunity for local governments along the way. But so I haven't set on any additional restrictions based on that conversation, but I think also what that conversation should highlight is that look, there are folks that even think that somehow this virus is going to go away the day after the election. You got hospital CMOs and others saying we need to take the steps to make sure that as we also go into flu and cold season, that we've got our hands around this thing. And we know what we have to do to get our hands around this thing. Several months ago I think it was several months ago that, I think Dr. Fauci said on one of those calls, if people would just follow these actions of wearing a mask and social distancing and washing your hands, something that we've been talking about now for far too long, well, that's as effective as closing down parts of our economy. So we know what we have to do, we just have to do it. John Riley.
Governor, this actually might be more of a question for Jim or I'm so sorry,
Dr. Holzman.
Dr. Holzman. As for billings reaching those single digits, did Roosevelt County play any role in that? Obviously, they're a much smaller by population county, but they're still in our top 6.
Yeah, so with respect to Roosevelt County, what we saw in the last week was a market increase into cases to about 189 cases just in the last week. So up dramatically from where they started before. It's a combination of a small outbreak in a congregate care setting, with the remaining cases being community transmission. Some of our populations in Montana have some unique challenges, and large households with a lot of different ages in them create some unique challenges. We have a fear that this will lead to hospitalizations as well. And as one of the doctors inferred here, is the current activity we're seeing right now, we have yet to see the hospitalizations that result from that. So that's kind of a dangerous trajectory to be on right now. So looking at any of these places that had such a remarkable increase, that's a little scary right now, because turning that around is going to take some time. So we'll be watching areas like that closely.
And then a follow-up question for you, Governor. How do we get people to buy in to mask wearing? Because we've been saying this time and again, and people seem as decided on either wearing or not wearing a mask as who they're going to vote for in this election.
First, let's step back and say, no, there are folks all across this state that are wearing their masks. And as our kids go to our schools, they're wearing the masks. And, you know, a lot of people are. And often then we can sort of just castigate and say, okay, everybody, it's all gone to... So many people are acting responsibly, not just for themselves, but worrying about their community. And I think that the way that we actually get there, first, I hope that there's a reason why every one of these press conferences or avails that I've said, we know the steps that we need to take if we're only going to take it. I recognize that me as the governor saying that isn't going to impact every single person. I hope that they'll actually listen to what Dr. Williams and Dr. Harkins say. Because for the last 8 months now, almost 7 months, that they've had to deal with this every single day. Our nurses have had to deal with COVID every single day. Our school administrators, as they're trying to figure out how to make sure to provide not just instruction, but the emotional supports our kids need and how to do it safely, are dealing with this every single day. So this isn't just my voice. Hopefully that folks will actually tune in to what doctors are saying, and that, especially in those counties and communities of high transmission, I mean, this is a partnership, and would encourage every county commissioner to be having the same thing, saying, here are the steps that we are taking, and every mayor to be doing the same as well. Well, thank you again, Dr. Williams and Dr. Harkins. Really appreciate your adding your voice and your perspective, but I also really appreciate all the good work that you're doing and your staff and crew in the hospitals to try to keep Montanans safe throughout all this. And thank all of you today.